Lights low, city glow, true tenor, yeah. Conversations heavy, but we handle with care. From love to the culture, the power and pain.
Good evening, everyone. Good evening. My name is James Jimmy Hills. I am the host of Java with Jimmy, and you are tuned in this evening for Java After Dark through our partnership with ABCD Health Services. We are this evening speaking with parents, and again, welcome to the Java Cafe. We want to welcome parents to do me a favor, and please go ahead and share this episode because this is especially for you. We want to make sure that sometimes our young people become a little independent. And in some cases, teenagers can request to see the doctors and things by themselves. And you want to be confident that if, you've had conversation with them about their health care, they've kind of taken some responsibility for their health care. We've come to let you know tonight that there are 8 school-based health centers in Boston Public Schools. I believe they're all Boston Public Schools. If not, we'll correct it at the end. But they have an option to see a healthcare provider while they're at school. And so we want to make sure that you have that available information this evening. And so we are going to bring in, and for those of you that know, I told y'all there's a whole show coming about me and pronunciation. And I should have asked Peter to say his last name before we went live. And Peter's in the background smiling. So I'm just going to go ahead and bring in Peter first. And this is Peter. I'm going to try Peter.
Go for it. Go for it.
Rempelicus. And it's Repelicus. The comma's cut
so
off.
Close. So close. It's
no prize.
Rempelakis.
Rempelakis. Is that Greek?
Yes.
Ah, okay, sir. All right.
Yeah.
And we're going to bring in Mamadou Samaharo.
You got it.
I did. Okay, I'm doing all right tonight. So, gentlemen, I want to thank both of you for being here this evening for a very important topic. And I just want to highlight something I just thought of. I said that, we want to get parents to share this and parents to be a part of the information. And, in a lot of the populations that I serve, we have a lot of moms that take a lot of responsibility for the young people. And while we're talking to parents, I'm just glad to have 2 men on here talking about our young people with health and mental health in a school-based setting. And so, Peter, you're first on my screen. I will ask you to please introduce yourself. And if you don't mind, at the end of your greeting and introduction, if you could give me one word to describe the mental health status of our teenagers presently.
Okay. Well,
hold on.
Limiting to one word is always problematic. My name is Peter Rempelakis. I am the Director of Child and Adolescent Mental Health for the Boston Public Health Commission. I work with school-based health centers, and I oversee the mental health care that students receive there. I also consult other youth-serving programs in the Boston Public Health Commission. And thinking of our young people's mental health, I would say stressed right now, but I would say 2 words actually: stressed and resilient.
We'll talk about that a little bit, Peter. For those that follow me, I struggle with that word resilience because the way you become more resilient is to be put in situations to be more resilient. And so we can unpack that a little bit, but I want to give a chance to Mamadou to say hello and also greet the audience. And I would ask you, Mamadou, if you could, from a health perspective with our young people, there's a lot of presumption that our young people are healthy, and presumably most of them are. But post COVID, I'm not really sure where we are with adolescent. I used to work in adolescent life options program. I haven't said adolescent health in a long time. You could say hello, greet the audience, and then by your observation with what you do at the health commission, can you give me one word for like the status of adolescent health based on, what you're hearing from your colleagues and patients you're seeing yourself?
Sure. Thank you for having me, Jimmy. My name is Mamadou Sumahoro. I am the director of the Boston Public Health Commission School-Based Health Center. And regarding adolescents, I will say also stress post-COVID.
And so that is forgive me for not clarifying, but Peter gave us sort of the mental health status. I'm asking more from and they're all intertwined and related, but from like a physical health, medical, that's something in real time. We know that stress wears on the body, but is there another word that would be more around a physicality observation that you're having with our young people?
Yes, I will say the needs are there to access healthcare, high quality healthcare at no cost. In terms of physicality, I will say not as healthy before as it was before COVID.
Interesting. Okay.
Yes.
Then thank you. That was sort of some of the context I was looking for. And so I'm going to continue with you. And I just want to share with the audience tonight that you will walk away with having a understanding of how our young people in healthy bodies and that mind concept. We're going to look at impact and outcomes based on what both Peter and Marmaduke said about stressed and also not as healthy. I believe that was his words. And so we're going to get into the conversation right now. And so, Marmaduke, if you could explain to me exactly what are school-based health centers. We say it casually. I'm familiar, but I didn't grow up. But we had a nurse, that if you had meds prescribed, if you didn't feel well, if you wanted to fake wheeze and try to go home, you went and saw the nurse. And so what is this concept of school-based health centers?
Sure. These are clinics located inside or near a school that provide comprehensive healthcare service to students. They're designed primarily to remove barrier to access to care, such as transportation, as well as cost and time. They're operated in partnership between the school, local health organization, and the community. They're really embedded in the Boston Public School partnership with the health center and Boston Public Health Commission. So school-based health center ultimately bring healthcare where students spend most of the day inside the school. And Boston currently has 8 school-based health center through a Boston Public School. So the school-based health center serve close to 4,000 youth annually, and which almost generate 12,000 visits per year. Across Massachusetts, there are over or close to 40 school-based health centers.
Thank you for that. And so you said about 12,000 students, you said 12,000 visits or 12,000 visits. So that is what we would call duplicate sort of numbers. And so what is the theme or what is the focus, Mamadou, of the approach to school-based health centers? Do you all have like a mission or sort of a theme for this year or whatever?
Yes, in general, and this is not just unique to Boston, but across the country. The theme is access to quality care at no cost.
Okay. And Peter, I wanted to come and ask you, there's the physicality that I was talking about with our young people, and Marmaduke talked about not as healthy, and you talked about stress. And so I want to ask, there's obviously the medical needs that can be met, but from your perspective, why do we even need school-based health centers? Marmaduke's talked a lot about affordable, I think he said high quality, healthcare as well. So why do our young people need that in a school-based setting?
Well, the need is well documented as far as their physically, diabetes is on the rise. 23% of adolescents are now diagnosed with diabetes or pre-diabetes, as opposed to 9% a decade ago. So that's a high increase. That's a national statistic. Locally, asthma, obesity, mental health issues, as well as conditions like ADHD, are highly prevalent among Boston school-age children, affecting approximately 1 in 3 kids. And then when it comes to sexual health, that even though young people make up about 25% of sexually active people, uh, there is they hold about 50% of the STIs rates. So so that includes gonorrhea, chlamydia is most common, HPV, genital herpes, HIV, and syphilis. Also, and for mental health, we're also seeing that 40% of high schoolers are reporting persistent sadness or hopelessness. About 20%, 1 in 5 of adolescents that screen positive for depression, and again, at 1 in 5 in surveys, 12 to 17-year-olds have reported unmet mental health care needs. So the needs are well documented. They're there. Why does care need to come in the form of a school-based health center? It's because that's where the students are. That's where they already have identities. To be a patient, to walk into a clinic in the community, requires that that's a higher threshold than a lot of adolescents are willing to make. Maybe their relatives work in the healthcare in the community health center. Maybe it's just maybe too exposing for them. So in school, they already have an identity. It's not as threatening to them. They can come in and get the care that they need.
And that's one of the things that I was asking Mamadou a couple of seconds ago, because I noticed in one of our emails that sort of the theme in your approach, and you said it, is, school-based health centers bring healthcare, to where students already are. And so, and then already are school, hopefully the majority of them. And so, Peter, I wanted to continue to ask, what is it that you can provide? You talk about stress. You're, I believe, a mental health clinician. There's the medical piece. And so if you could talk a little bit about what the school-based services provide, and then we'll come back to Marmaduke for a few more questions.
Okay. Well, first of all, it is the lowest threshold to care that students, a parent just needs to sign consent for a student to become a member of the health center, and they can use all the services.
So can I ask a clarifying question there, as far as, because it's the school-based health center, they have to have parents' consent to participate there, versus at like a community health center, young people can go in, I believe it, you can correct me, they have some level of confidentiality at a certain age here in the state of Massachusetts. Is that different in a school-based setting?
No, so for reproductive health, and this is true for reproductive health, a student can self-consent. But for all services, including mental health, parental consent, one parental consent is necessary. For other providers, they need separate parental consents for each service that they receive outside of reproductive health. The only thing that's that is kind of freed up for young people to self-consent for is reproductive health in the state right now.
Okay. Got you. I just wanted to clarify that just to make sure, because I've talked about independence. I used to be a youth worker, and actually that was most of the time when the young people came in on their own, was around reproductive, sort of issues. Okay. And so what else is it that you provide? There's the uh, permission that is granted, and then from there, what can they take advantage of?
Well,
Sure, Jerry.
they can speak to a health educator about their options for reproductive health or other health issues. They can see a nurse practitioner who is fully able to provide all the medical services they need, and they can see a well-trained, culturally competent mental health clinician who is who doesn't work for the school, and none of us. So it's nice to have a health center where the staff doesn't work for the school. Our focus, we want to help our students succeed academically, but that's not our main focus. We're going to look at all of them. We're going to look at them in the entirety and what they need, and look at them as people, not just as students in their academic performance. And in so doing, studies have shown that schools with that CPA school-based health centers have been had a positive impact on attendance for young African American men, and so there's data about that. So again, not only do can we provide the care that doesn't take them out of school to get care, but we also provide relationships that help make school a more friendly place, and engage and help them engage more with their education, their school.
Absolutely. And Marmaduke, I'm going to come back to you and talk about the school-based health center team. What are the teams typically or how, not what, or what type of disciplines are the teams currently constructed?
Sure. The team is structured with a medical provider, a mental health provider, a health educator, and an admin assistant. The core service that the team provide, it's a primary care service. For example, a sick visit for chronic condition, which are managed generally by the medical provider, sport physical, routine checkup, reproductive health services, pregnancy testing, STI treatment, mental health counseling, and health education and prevention service. It's a true one-stop for physical and mental health. And I just want to go back to some of the things that Peter listed. The way students access care, it's by getting parental consent. But we also have a group of students who are 18 and older who can self-consent because they're legally adults. And for our reproductive health service, because of the confidentiality nature of that service, students can self-consent for the service as well.
Absolutely. Thank you for that clarity. Because I had meant, and to remind me, I had meant to say when Peter gave the clarity, we're going to come back to him in 1 second, but I meant to say 17 and under, you definitely need the parental consent. But upon turning 18, there were a few months of my senior year in high school. And, back when we had report cards and physical, my mother didn't have to sign my report card because, I was grown at 18 years old. So 18, you can take advantage of all the services, including mental health by yourself. And so, Peter, I want to come back to you and ask you, what are the benefits? We talked about the convenience, them being in school already, but what are some of the other benefits? You can feel free to just freestyle, from what you know in your experience, to, talk about the benefits.
So the benefits are that we get to know the whole student in the context of their school. So we get to see their functioning. Our clinicians are really great at becoming members of the school community. So they see the students out and about and interacting with others. So they really kind of fit into and get to know the whole social strata as well as the academic situation for the students. We do a good job of making sure our clinicians are trained on the issues that are most prevalent for our students. So we do a lot of trauma training. We do a lot of, we've done this past year, we've done training in substance use and interventions with regard to that. We also, most of our kids are dealing with loss. And so grief becomes a real issue, and that's been accentuated since COVID, but it certainly has continued with also the increased deportations and disruptions of families. So we see a lot. These are the stresses that we do see arising.
That was to the point that, when you said stress earlier, I definitely understand that. And I think we have to keep sort of that in mind. There's the regular stress of going to school. There's the regular stress of puberty. I think two other things that's more common for our students that aren't dealing with family members that are, our brothers and sisters, our migrant brothers and sisters. There's the social media piece. And then to have compiled with that if I go to school, if my mother comes and visits or whatever, there and there's some different rules here in Boston, but just away from school, for a student to have to deal with that is very interesting. And so, Peter, is there at any point, you mentioned that you would need permission for kind of, I think the word when I was in medicine, ancillary services or referrals out? What type of referrals, if you're not able and equipped with the staff that Mamadou named, that most of the centers are staffed with, what type of referrals usually go out from within the school-based centers?
So there's certainly referrals to other providers, and what I think is one of the only drawbacks to the school-based health center system is that we are there when school's in session, and we're not. The staff has the summer off, so we often will refer to other providers to cover those months, or if we think that they need a community-based provider, but we're the entryway. We often are their first experience in whether it's mental health care or understanding their own agency in their own health care. We're kind of the user-friendly starter kit, to get as they step into adulthood, to know how to advocate for themselves, to know how to ask questions, to know how to navigate what can be a hostile and historically has been a hostile experience for especially people of color. So we have and that's on the medical and behavioral health end. So we work with BMC. We're partners with BMC, but we'll work with whatever provider the family and student prefer. We also as far as I'm concerned, mental health doesn't just happen within a clinical hour. It's not just about the therapy they're getting. It's also, where is this young person engaged? Where are their passions? What are their interests? How can we scaffold interests and activities in their lives and connections in their lives that will really help sustain them? Because relationships are the biggest healer we have.
That is a major thing. I was going to say that's programs with our young people as a youth worker. Relationships is one of the key things. Go ahead and finish. I'm sorry.
Oh, I'm sorry. So that means arts programs, athletic programs, youth centers, theater. Where we try to plug students in as much as possible into what will excite them and what will give them a spark.
Absolutely. Mamadou, if I could come back to you and ask you, what are some of the, examples? I asked Peter about referrals going out, that continuum. Oh God, I'm going back to I used to run a pulmonary and critical care fellowship on the admin side. So now I'm thinking about some of those terms, and I just lost it that quick. But the referrals, like what are some of the continuity of care? How do you all handle a continuity of care? Peter, I think, raising the point about having the relationship September through June, then you got to kind of refer and let them go out for the summer when they've been with you for 10 months. I know that's interesting. And so, Marmaduke, how is there a continuum of care? Also, what Peter said about like the referrals that go out for medicine, let's say you refer someone to endocrinology. How do you keep up with what's, going on?
Yes, thank you, Jamie. So basically, most of the students who come to us, I want to indicate, primarily have a primary care physician. So the continuum of care, take place because our providers are in constant communication with the student primary care. And also when we refer student to a subspecialty, our medical provider always ensure that there is a line of communication between uh, that subspecialty provider and themselves. So should the student need any additional care throughout the summer, which we're not open, that we ensure that whatever service was provided, it's also made known by the subspecialty to which the student is referred to. And that's one of the primary responsibility of our CHW community health worker.
Absolutely. And then, Peter, I want to come back to you and ask you, like, with the mental health, there is a parental, there's permission given, but like at what level what type of mental health services are provided in the school-based health centers, even with the permission, or 18-year-old, like basically keep it simple. How far do you go in your treatment in a school base? Do you practice psychopharmacology? Do you, make prescriptions?
Right.
Like, tell us about the mental health perspective from the
Sure.
services provided.
Sure. So we do not have prescribers among the mental health clinicians. We're all master's level clinicians that don't have prescribing rights, but we do partner with Boston Medical Center, and we have a psychiatrist who's a consultant with our program who also is the medical director for the adolescent community-based crisis center. So we can refer directly there. We can refer to PMC. We also use the same medical record, electronic medical record system, so we can communicate that way. So we do have access to care, and if the family, sometimes the family and the primary clinician, physician feel comfortable diagnosing and write a script, that's fine. We work with them and support that. But I also want to say, when it comes to continuity, we may have those breaks, and those breaks are sometimes vacation, and it's a break from treatment. But we also, a lot of our schools start in 7th grade, so we have the ability, and I have an incredibly stable staff that have been doing this work a long time and love their jobs and love meeting with the kids. So they're there from 7th grade to 12th grade. That's a long time to work with a young person and to see them through a lot of changes.
It's so interesting as we get ready to wrap up that, as I said, we had a nurse in school, and I wonder how things would be different for some young people that may, and there's early onset diabetes. I remember term juvenile diabetes and things like that. And Marmaduke, to your point, that you've noticed that our young people are not as healthy as they were before COVID. And in the adult space, I've often talked about things like screenings for our adults. We don't, we're behind to some extent. And then, our young people, now I thought about it, so I'll ask, are there certain screenings away from, reproductive, y'all say reproductive health, I was going to say sexual activity. Are there, away from those, are there screenings that are typically done at an adolescent stage that, for whatever reason, they're not keeping up with their primary care physician, they're not practicing routine and preventative health care? Are there screenings for adolescents? And if so, are they done as a part of the medical service provided in the school-based health centers? Kind of off the cuff question, but I just thought about it with your remarks about post-COVID not being as healthy.
Yes, one example is for students who are diagnosed with diabetes or asthma, for example. There's a constant monitoring of the glucose with a regular checkup. It is a requirement that every student who consent for the school-based health center had an initial visit with our medical provider for a general checkup. But particularly, I want to focus on those diagnosed with a chronic condition like diabetes, for example. The glucose monitoring is something that our provider will do on a regular basis. And based on the outcome of those screening, they will communicate with the student PCP or endocrinologist. Another example is hypertension, routine blood pressure checkup at school, and also always making sure that there is a follow-up with the PCPs.
That is something I just thought about because as we were talking about, not as healthy, again, I used to be in adolescent medicine, but now I focus on, a seasoned folks on that particular level of health. And a lot of that has included screenings and things like that. So it definitely is good to hear that you all have that in the background there to make sure that they are properly monitored. So, all right, we want to make sure before we wrap up, I want to make sure, and I'll post this later, but if you all are interested, we want to make sure that the 8 schools where the school-based health centers are located, and those would be, and it's partially my alma mater, another course to college, also the Ruth Batson Academy, Boston Latin Academy, and also New Mission High School, Brighton High School, Dr. Albert D. Highland High School of Technology, Dr. D. Holland High School of Technology, aka
formerly the Burke.
I was getting Peter, don't do it because I was getting hold on for 1 second. I was going to say I'm old. I was going to say for those of you that don't know, that's the Burke. So for us old heads, that's the Burke. Madison Park High School is the other half of my alma mater. And then the Snowden as well. And we want to note, as you see, 2 of them are mental health only, which is at ACC and also at Ruth Batson Academy. However, Boston Latin, New Mission, Brighton High, the Albert D. Holland, because we have a middle school Holland, Madison Park, and also the Snowden. They are full service providers there with a let me get this right, Marmaduke, with a medical provider, a mental health provider, a nurse, and administrative assistant.
Yes, that is correct. And Jimmy, if time allow, I just want to piggyback on your question about the benefit of school-based health center. I just want to piggyback of some of the things that Peter said. One of the greatest benefit is that our services are free of charge. We do see the student whether they have an insurance or not. And there's also the intangible benefit of our services and program. It's the effect that those services have on the community. So an example is when we see a student, for example, who has been diagnosed with asthma, and we help them manage their asthma, we're reducing the number of ER visits that those students have with the parents, therefore having a better impact on the life of the parents as well.
That is though the crisis, may still be the same, having that resolved at school, if you can resolve it, and the parent not getting that phone call that they're going to the ER, or the student going to the ER alarming the parent, versus if at school, they may be more, and what you said about relationships, they may be more inclined to say, hey, I'm having a little trouble breathing today. And so hearing that benefit is definitely awesome. I want to make sure we just remind folks, and again, I will post it, that these are the schools to which school-based health centers are located. So please take a screenshot or save it when I post it on my page as well. And so Peter and Mamadou, I really appreciate both of you. I know you guys are, you don't do rounds anymore and you're not used to the late hours, but I'm glad to have both of you here, and thank you. And please give Dr. Ojukutu and Jeremiah and Brother Yablo, Dr. Yablo, all those folks over there. Please give them my best and tell them I said hello. And I appreciate you both being here with us tonight.
Thank you, Jimmy.
Pleasure. Thank you.
For having us.
Thank you both.
Thank you.
Have a good evening, you guys. Thank you.
You too.
Take care. Bye-bye.
Folks, I just wanted to remind you again with our partnership with ABCD Health Services, we are actually using their space very soon on May 16th for our health fair. And ABCD will be in the building that day with the table to talk about all the services provided through their network. As we know, there are 12 network partners that they have. And for some of you, you will meet them next Thursday night. And I'll just leave that right there. All right, we're going to get ready to wrap up. Thank all of you that joined us this evening. And we will see you on Monday at 10 a.m. And please keep in mind, speaking with the Health Commission, we are going to have the commissioner of the Health Commission on our show on Tuesday at 10 a.m. for Your Healthy Java. So thank you all for being here this evening. And we will talk to you very, very soon. Yes, well, I just saw a comment. We'll see you all on Monday at 10 a.m.